Hello everybody, my name is Just Jennifer Beauty and today I have a very special guest. I have got Dr. Apul Parikh, who is going to demystify anti-wrinkle injections. So it's extremely exciting. We're just going to wait for Apul to come on. He is there, so I am going to send him a request. Thanks for joining. Hey Nicola. Hey everyone. Thank you for coming on. So the reason why I'm doing this is because a lot of my Instagram family have been asking me what I think. Here he is. What I think about Botox and anti-wrinkle injections. And I thought, let's bring on a professional to talk to us. Hello Apple. How are you?
Hi, Jen. I'm lovely. Well, thanks. How are you? How are you doing?
Good. I'm good, thank you. Your sound is a little bit low. Let me turn this up. There we go.
How's that?
Let's
Any
see.
better?
Yeah, that's better.
Okay.
That's better.
Perfect.
Guys watching at home, can you hear us okay? Just give me a thumbs up or a heart. That would be really good. So, yes, thank you so much for joining us today. How are you doing?
I'm well, thanks. I've had a really, really great day. I'm very relaxed, so can't complain.
Good, good. And we've got people coming on now, so thank you so much everyone for joining. Guys, if you've got any questions in particular about Botox and anti-wrinkle injections, and I'll tell you why I'm doing it in inverted commas in a minute, just drop your questions and I will try and keep an eye on them and we'll try and answer as much as we can. So you taught me this week actually about the term Botox, because it's something that everybody just says, oh, have you had Botox, or what do you think about Botox? And actually, when I first put a story up to say we were going to do this live, I'd put the truth, the myths and facts about Botox. So you taught me that that's just like a trademark term now, isn't it?
Correct. So the word Botox is actually just a brand name, right? For a company that produces anti-wrinkle injections. It's made by probably the biggest company in the world, that's Allergan, and their brand of the neuromodulating medication, which we otherwise call anti-wrinkle injections, is known as Botox. So a lot of people will say we're doing Botox, but that doesn't necessarily mean they're doing the same with the same medication.
Yes. Okay, fine. So if people haven't heard of the term anti-wrinkle injections, it's basically doing the same sort of thing, but it's not using the brand
Correct.
Botox medication,
Yes,
right?
absolutely. But it's important that it's kind of become a term that we use generically, but there is a difference in the different types of medications, where they're produced, the level of care that goes behind them, the FDA approval, how long they last for, potential complications, etc. So although we kind of trivialize it, it actually is a really important point. And for patients out there, they need to, when they see a practitioner, try to find out what actual brand they are having injected into their faces.
Right. Yeah, because it all makes a difference.
Correct, yeah. The units, the amount that we put in varies significantly from company to company. They're not interchangeable. It's not like one apple from Waitrose and one apple from Sainsbury's. They're completely different. You might need 10 units and only 1 unit of Botox, so it's actually quite an important point.
Okay. Oh, thank you for that. So for anyone who doesn't really understand, they may have heard of anti-wrinkle injections, but maybe they don't actually know what it does. Would you be able to explain a little bit about that for us, please, about what they actually do?
So the way these medications work, and it's important that I use the word medication, these are prescription medications and should thus be carried out by medical professionals who can prescribe them.
Right.
So what they do is they basically send out messages that block the messages from the brain which go to the muscles, which say move. So we try to suppress the amount of movement that happens in the muscles, and it's a temporary phenomenon. And what happens if we put too much in, then people may get completely frozen or immobile. And if we put what I think the right amount is, we just soften the movement, keep it natural. It looks better. So it basically modulates the messages from the brain going to the muscle saying, "Can you move?" We try to soften those impulses.
Right, right. Okay. And so when you have an anti-wrinkle injection, how long does that effect last for the
So it
nerves?
varies from person to person.
Okay.
With Usually you're looking at 3 to 4 months time. There are a few sort of extremes. Some people unfortunately last for about 2 months. Some people get to the 5, 6 month mark, but the vast majority are between that 3 to 4 month mark. And gradually it just regains complete natural and normal movement after that.
Okay. So I know that one of my Instagram followers was asking, if you have Botox once, does that mean you have to, or sorry, anti-wrinkle injections once, do you have to continue using it? Once you start, you can't stop, or if you don't have it again, will you go back to how you were before?
Yeah, I hear this a lot, and certainly it's not something that patients have to keep using. Definitely, a lot of patients continue to keep using because they like the result, they like the effect. But let's also keep in mind that, I use this on a regular basis to treat medical conditions such as migraines, chronic pain,
Oh,
spasms, so it's something that we use regularly for other conditions as well. But if we stick to say the aesthetic ones, just for now, the aesthetic indications, I have loads of patients who have it for a couple of years, and then maybe, for example, the female patients may decide to get pregnant, so they stop because it's not a medication you can take when people are pregnant or breastfeeding. So they stop, and then whenever they feel comfortable, they can restart once they've had their baby and stop breastfeeding.
yeah.
So it's not something that has to be continued. It definitely, I would say most patients choose to continue, but it's not,
Yes.
something that they have to do.
Yeah, yeah. Once they get used to having less wrinkles, it's hard. It would
Correct.
be hard to go back to how you were before. But you don't have to because it doesn't make it worse, which is the
Correct.
important
Correct.
thing.
Yeah.
So
So that's the other really good point. And a lot of patients do say, I had it for a few years, and then the moment I stopped, I looked terrible, and I was a lot worse than when I started. Now, say a patient's been using it for 10 years, and it's been keeping sort of the wrinkles at bay, keeping the skin looking fresh and natural. Don't forget that throughout that 10 years, the natural process of aging has been taking
yeah,
place. So, skin changes have taken place. We've lost volume in the fat. Perhaps we've got some sun damage. All of these factors are continuing, but the medication, Botox, is keeping it at bay. So
yeah,
when they stop, they don't go back to their norm, but their norm has shifted
has
for,
shifted.
for 10 years. It's not
Yes,
what they were 10 years ago. So it doesn't freeze you in time. So that's the other thing, which I hear a lot, Jan. But certainly there's no such thing like it'll make you look worse or more aged if you stop. Nothing at
yes,
all like that.
yeah. Okay, fabulous. So, are there any circumstances, you talked about pregnancy and
Mhm.
breastfeeding? Are there any other sort of conditions where you would not want to perform anti-wrinkle injections on someone?
So I think that the main medical conditions are, as we said, pregnancy, breastfeeding. There are a few other medical conditions, neurological conditions
Okay.
such as Parkinson's, where people have issues with mobility and these
Yeah.
impulses from the brain aren't
Yeah.
working well. So definitely those are contraindications. Other things that, are if there's sort of infection or a patch of eczema or psoriasis over the area you're going to inject through, you will obviously delay till everything's
Yeah.
calmed down. Or if people are insulin dependent diabetics, for example, and their diabetes isn't under control, it's always worth trying to sort those things out.
Exactly.
But it is a phenomenally safe medication. It really, really is. the aesthetic indications for it are probably about 10 to 15% of what it's really used for in hospitals globally on a daily basis.
Yeah.
And because of that, there have been fantastic studies which have, got 30, 40 years longevity, really long studies looking at the safety, efficacy, and there's absolutely very, very little that can go wrong with it.
Yeah, fabulous. And of course, that is if you are going to see a professional who is correctly trained. So
Yeah,
I know that a lot of people come to me saying, but how do I know who should be doing my anti-wrinkle injections?
correct.
Because how can people find out, apart from going to you and speaking to you, how can people find the right qualified person to do this for them, and not just a high street, salon that's decided that they're going to do it and that person isn't correctly trained? How can you tell?
Yeah. Yeah, that's such a good point, and we see more and more of this on a regular basis with patients who've had, say, unsatisfactory treatments or
Mm,
complications, and they always say, well, I didn't know where to go. It's one of those things where I do think patients need to take a little bit of responsibility and research where they're going to have these procedures done. You want to be going to a reputable clinic and checking the credentials of the person injecting you. It should be a doctor, a dentist, or a nurse, someone of that qualification, really, who should be doing your injections.
yeah,
And the other aspect of it, apart from patients researching where they do it, as I said, it's really important to find out what product they are using. There was recently actually quite a large shipment of fake medication that was impounded in the
oh
UK,
my gosh,
so we need to be really careful about this. So it is, it is difficult, I understand. There's so many sort of people offering it,
yeah,
but I do think patients need to be just a little bit more careful and sort of do a bit of research to find out who's doing the injections, what their
yeah,
training is, what their qualifications are, where are they having it
yeah,
done? I think
yeah,
it's a bit sort of, it's a bit amiss if someone's having these sort of procedures done in a hairdresser's or a spa or something.
yeah,
You just need to make sure it's a slightly regulated medical clinic.
yeah, yeah, because there are sort of these online 2-day courses that people can go on to get
Correct. Yeah.
qualifications, and so people do, I would say that's one of the biggest things, that you need to really research who you're going to
Correct.
see and trust that they are a professional.
Yeah, absolutely. It is scary. I see these courses advertised all the time
Yeah,
on social media and
yeah,
things, and you think, wow,
yeah,
God, that is scary.
yeah. And so where can you have anti-wrinkle injections?
So the most common areas would be the face. And we kind of tend to think just the frown area, the forehead, and the eyes to soften those areas. But increasingly, I try when I'm treating my patients to treat the whole face just to balance things out. It's all very well looking refreshed on the upper third of the face, but we do get wrinkles developing around the nose, the upper lip, the
Yeah.
chin, and even down onto the neck. So it's important again to go to somebody who knows how to assess your face and knows how to
Mm,
carry out injections in different parts of the face. So although the most common areas would be the upper third, certainly the lower third and neck are really, really important areas as
yeah,
well.
yeah,
And then, as I said, for migraine treatments, often come round to the back of the scalp, the neck, and even coming onto the larger neck muscles, where we often hold a lot of
uh,
tension and
yeah,
pain in, so those work incredibly, incredibly well.
yeah.
And another great area where we use these injections are for patients who sweat a lot. So from their
Oh,
armpits, you have something called axillary hyperhidrosis, which is just the excess production of sweat, which actually is a very debilitating and very
yeah,
embarrassing condition for patients who have this.
yeah,
And there's not much in terms of other treatments available, which works as well as the anti-wrinkle injection. So that's again quite a common
Wow.
area. And it's funny how that happens in seasons. You kind of see it just around summertime where people are getting on the tubes and it's really, really hot and sweaty, uncomfortable. And sort of this season now, winter coat
Yeah.
season, and again, things get really hot underneath the coat. So,
Yeah.
so you kind of see two phases of that, but it's a really common area where we do the injections as well.
Wow. I never knew that. So you can use it
Yeah,
for pain and mainly migraines and also excessive sweating as well.
correct. Yeah.
Wow.
And as I said, in the hospital, Jennifer, it's used for many other things. And people using it for hyperactive bladders, kids with cerebral palsy, with
Mm.
what muscle
Mm.
spasms, all sorts of things. It's used for. So it
Yeah.
really is a really fantastic medication in the right hands.
Yeah. Yeah, of course. Fabulous. So what if someone was coming to you, what things shouldn't they do before they have an anti-wrinkle injection? Like, I think, is there coffee and alcohol is kind of a no beforehand, or is
Yeah.
that a myth? Or
Sure. So I think the first thing is that even before we get to the stage of them coming in for the injections, they should have a consultation,
yeah.
and I think it's really important to have a consultation, as we said, with someone who's trained, who will assess your face, go through things and say, this is the plan, this is what I suggest we do. And, again, things like pricing, all of those things should be clarified in
Yeah.
advance. And then you're right, if the patient decides to go ahead and come in for the injections, you're absolutely right. So one of the key things I say is, first of all, come in without any makeup on. We need to really cleanse the face properly with these injections. And if you're sort of washing off or wiping up makeup, you're often irritating the skin,
Yeah.
increasing the risk of potential infections through these injections. So that's really a key thing. Things with not drinking alcohol and coffee, yeah, I agree. I would definitely avoid those. They increase the risk of bruising, really.
Right.
So definitely would suggest to avoid them as well.
Yeah.
And apart from that, it's also important. The post-injection care is also really important, and patients need to be careful for the first 24 hours, especially in terms of exercise.
Hmm.
You want to try not to do anything super active. And again, avoiding things like steam, hot baths, that sort of thing.
Yeah. 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 And so how long should someone not wear makeup for after having anti-wrinkle injections? Is it just that day, or?
I lost you for a second,
Oh,
Jen. Sorry.
sorry. So how long should someone not wear makeup for after they've had an anti-wrinkle injection?
So ideally that day,
Okay.
that would be great. Yeah, I must admit I have some patients who look at me very strangely when I say that. But ideally the day.
Okay, fabulous. And have you got are there any other tips or things that they should look out for with anti-wrinkle injections that spring to mind that we haven't talked about?
So I think we've
Any?
covered most of them. I
Yeah.
think the main thing is just be a little bit sort of rigid, a bit careful with choosing your practitioner. As I said, there are a lot of people who aren't qualified, who are importing this stuff from who knows where. I don't really know what's
Is
actually in the
in it.
medication, and there could be some really horrendous complications from that.
Yeah.
And
Yeah.
the other thing, which I suppose we haven't discussed, is the age of patients.
Yeah.
It's one of those things where I probably have patients from their late mid 30s going up to 70, 75, 80 even. And it's a great big spectrum of patients who it can work for. I do get patients who are very young, girls, or I say girls, I suppose ladies, 18, 20, or even young men coming in at that age. And I think, at that age, it's really a little bit young, and you want to
Mm.
try to just make sure, again, you're going to someone who can give you the really good advice and say, actually, you know what, you don't need it for a few years, go away, rather than just going to somebody who will just stick an injection in your face.
And take the money.
Yeah, exactly. So those are really key
Yeah.
aspects as well.
Yeah. And I suppose then that brings me on to a question. So
Hmm.
for people who already have resting wrinkles, deeper set wrinkles, it's not too late for them to have anti-wrinkle injections. It will make a difference.
Yeah, that's a really good point. So, if the lines are really, really deep set and very thick lines, it's hard. And again, you will need to have really detailed consultation
Mm,
just to see how much of a benefit it will be. There's usually will be at least some benefit. It may not completely remove the lines, but at that age, depending on what the patient is, they wouldn't want to have a completely
no.
line-free forehead or eyes. Or there's always some improvement that's usually possible,
Yeah.
but a lot of patients now try to come a little bit early, saying, I've developed a few lines, but I don't want to get as bad as my mum or my
Yeah.
dad, or what do you think? And that's probably the right time to come in. So I
Yeah.
wouldn't say there's ever a wrong time. I've had a patient come in fact, earlier on this week in her mid-60s and never had any treatment before. And certainly part of her face I thought would gain a really good improvement from it. So yeah, I think the
Yeah.
detailed consultation is what's the key there.
Yeah. Definitely. And of course, as well as anti-wrinkle injections, if you are, I'm not telling anyone do get them, don't get them.
Hmm,
I'm just providing
correct.
this information with Dr. Apul because so many people have been asking me about it. So as well as that, you need to have a healthy lifestyle as well and a good skincare routine, because it's all
Super
very well
important.
and good having these injections, but
Yeah,
if your lifestyle is going against that and you're not looking after your body and your skin,
correct.
it's kind of counterproductive, right?
Absolutely. I totally agree. Totally agree. I think you've put it fantastic. I mean, patients who really don't look after the skin. I've seen patients come in their early 30s who probably look like they're 50
Yeah.
because they've got so much sun damage. They don't look after their skin, they don't protect it, and I think you're absolutely right. We need to make sure all of our patients are using really good skincare, not
Yeah.
necessarily buying something that's been endorsed by a celeb. I
Yeah.
mean, I have this every day from patients. I have this from my daughters, insisting buying something because someone on TikTok's endorsing this
TikTok.
cream. It's
Yeah.
it's such a big thing. But it's someone ideally this is a professional. I know your skincare is fantastic. The
Thank
advice you give,
you.
I've used it. So it's really important that it goes hand in
Yeah.
hand. And as you say, the lifestyle. People who are smoking naturally have really unhealthy skin as well.
Yeah.
They lose their sheen, but they lose their collagen, their elastin, they get more and more premature wrinkles. So you're absolutely right. If you're having these injections, it's about trying to modify and improve your lifestyle as well.
Yeah. Yeah. It's a whole round
Yeah,
effect, isn't it?
correct. Absolutely. I tell patients, you're coming in for these treatments, and I'm not here to tell you to stop smoking because your lungs are going to get spoiled, because you know that. The
Yeah.
GP's job is to tell you that. I'm telling you, you're going to ruin your face, so
Yeah.
stop smoking.
Yeah.
It's just one of those things. Yeah.
Yeah. And then, and one other thing, I know you're super busy, so I
So,
don't want to take up too
so,
much of your time, and I really appreciate it. One other thing that I just like to touch upon is, can we just talk about, if you are going to have sort of one area, say for
mhm,
example crow's
mhm.
feet, then one thing that you need to be aware of is that you may notice other lines in that are already there, that weren't noticeable before
Correct.
because you had the lines already. Do you know what I'm trying to
Yeah,
say?
yeah,
That,
absolutely. Yeah, that's such a good point. And this is why, when I try to treat patients, I try to treat the entire
yeah,
face to keep everything balanced. But you're
yes,
absolutely right. I have so many patients saying, I think something is wrong with the Botox. My eyes look a lot softer, but look at my forehead lines, it becomes so much worse. And it's just
yeah,
part of the education process when they come in.
yeah,
And this is why all my patients get really detailed photographs taken as well, just so we can see the difference, decide whether we need to potentially add some more, but
yeah,
then also then to show the changes in the other parts of the face, which
yeah.
potentially look worse, but are just the same baseline level.
Exactly. And I think that's where it's really key that everyone needs to have a really thorough
Yeah,
consultation to understand what things will look like when, if your eyes aren't drawn to your lines here, they may be drawn to lines here if you hadn't had it
Correct.
done there. And so it's
Absolutely.
really important to understand
Yeah.
how the whole face is going to be. Definitely.
Yeah,
Yeah.
I agree.
So, Apul, where are you based?
So I'm in Victoria, right, sort of a couple of minutes from the tube station, pretty right next to the Goring Hotel, really. So pretty centrally located, is where the clinic is. I do a lot of teaching and training left, so I'm not in clinic all day. I'm a lecturer at UCL, where I lecture in the surgical anatomy division as well. And I do a lot of international teaching and training as well. But the
Wow.
clinic's based in London,
So you're in
Victoria.
London.
Yeah.
Yeah, fabulous. So if anyone doesn't follow Apple, then please go ahead and follow. I am going to be saving this to both of our feeds, so you can always drop him a message and he can take it from there and help you with any other further questions you might have. And Apple, do you do any other treatments at all?
So with the Botox, the other injections I do are dermal fillers, a lot of dermal filler injections. The other thing is I spend a lot of time on skincare using
Okay.
microneedling, and there are a lot of new things coming in the world of microneedling. Super excited, where we have these growth factors, and now we have exosomes as well coming in, which really revolutionize how our skin can change. And with my background in plastic surgery, I do a lot of minor ops still, all the local anesthetic procedures, just taking off moles and cysts and small things in the clinic as well.
Yeah. And so someone of your caliber is definitely the type of person that you want doing anti-wrinkle injections rather than going to the hairdressers and sitting in the corner and having someone stab your face with a needle.
Well, you're very kind, but it is true. I've had patients come in. In fact, I had one not so long ago came in who had the hairdresser do her injections, and I just tried to understand her train of thought. And I said, well, if you came in here today and I said, I can't do much about your face, but let me have a go and perm your hair, or I'll dye it for you. And she thought that was really strange. And I couldn't quite understand why she didn't think a hairdresser doing her injections is really strange as well.
Yeah.
So yeah,
Yeah.
just a little bit of research I think needs to be done.
Yeah. Yeah. Oh, well, that was super insightful. Really, really wonderful. Thank you so much for taking your
Such a
time
pleasure.
today.
Thanks for having me,
Oh,
Jen. Great fun talking to
you're
you as
welcome. Oh,
always.
and Lucy says he's handsome.
Ah!
So there you go.
Very kind. Get your eyes checked, Lucy.
Oh, thank you ever so much. Have a
Such a
wonderful
pleasure.
evening.
Thanks,
All
Jen. Take care. Chat
right.
to you soon.
Take
All the
care,
best.
everyone.
Bye, guys.
Bye.
Thanks, everyone. Bye.